1.
All right, hi. Welcome to the presentation of how modern medicine is currently combating the adaptations with glioblastoma. My name is Kelly, and I'll be presenting the following slides with my classmates Elijah and Jordan. Glioblastoma is a common type of malignant brain tumor that is usually aggressive. Like many other types of cancer, there's currently no known cure. It is known that glioblastoma commonly starts in the cerebellum. This placement can make it difficult to remove the tumor, as surgery could cause permanent damage to the area of the brain. The survival rate of glioblastoma patients is relatively low, and it decreases each year.
Sorry. I had to move for a second. There's plenty we don't know about the specific cells that originate glioblastoma from within the brain tissue. So when it comes to our approach to take on such a matter, we set down two very important goals to accurately dictate what exactly we're trying to find. Firstly, we'd investigate the expression of genes between our 5 different patients that express evidence of glioblastoma, as well as the 2 healthy patients, and compare the specific genes that were expressed among those individuals. The ones that showcase higher expression within those sequences would be evidence to support the origin of glioblastoma. Following that, we'd take that evidence we found and combine it with our current perspective on glioblastoma and how to treat it, which should not only allow better insight into the complex molecular mechanisms that lead to the growth of glioblastoma, but leave more room for stronger medical identification and therapeutic strategies to be put in place for such a cancerous disease.
When someone is diagnosed with glioblastoma cancer, it is thought that they are expected to go through treatments up to 12 to 18 months. There are a few different types of treatment that patients can go through depending on the stage of gliomas they are in. There are 4 different stages of gliomas, which are measured by grade or how aggressive the tumor looks from under a microscope. There's a video below that to further explain, but I'll summarize it up. There are 4 grades of gliomas. Grade 1, JPA, which is benign and can be cured with surgery alone. Grade 2 is also called low grade. They are mostly treated with surgery, but may need treatment further on after surgery has been done. Grade 3 gliomas are classified as high-grade gliomas. Surgery is the best treatment, but they're almost always followed by chemotherapy or radiology. Grade 4 gliomas, or glioblastomas, are the most aggressive brain tumors, and they require surgery as well as radiation. Treatment options such as surgery, chemotherapy, and radiation can be done to help increase the survival rate, but it will not guarantee the survival of the patient. Since the cancer is one of the harshest types, it can be very hard for patients to go through all the treatments and make it out with minimal brain damage.
Since there is no found cure for glioblastoma, there is always ongoing research being done to try and increase the survival rates. The development of glioblastoma does have relation to a specific hierarchy. There have been experiments that have studied both unhealthy individual brains and fetal healthy brains to compare. There have been hypotheses created, which the research says that this connection can be used as a hierarchy map of cancer cells located in the brain. This information can help us further study why the unhealthy brain cells target the healthy ones and can potentially help researchers find a way to stop this cancer.
For our specific hypothesis, we used various materials to figure out what exactly our plan of attack would be. Essentially, we researched to find the SRA sequences to unhealthy individuals' brains that suffer from glioblastoma and compared it to the sequences of healthy individuals that never suffer from the disease. We imputed the genes of both individuals into Cyverse, which is a website that allowed us to properly handle the data sets and organize their computational infrastructure, and analyze the gene expression of our 7 samples. Once the sequences were organized, we had a list of expressed genes among all of our samples. We used a program called RStudio to accurately recognize the significant differences in the data and plot the specific genes that would be significant enough for our data set.
As stated before, there is no known cure for glioblastoma. However, there are treatments that may help slow down the growth of the tumor. The most common type of treatment for GBM is surgery, followed by radiation and oral chemotherapy. This surgery is not very effective as it can be difficult to remove the whole glioblastoma tumor without damaging the brain. After surgery, surgeons may implant a medicated wafer into the brain, which slowly releases chemotherapy drugs over the tumor area, which I showed a picture of on the right side. In 2013, a new chemotherapy pill called temozolomide was made and approved by the FDA. While it does not stop the growth of glioblastoma tumors, it does slow down the tumor's process. And as of 2021, a new FDA-approved chemotherapy is being tested in a clinical setting. It is a type of electric field therapy that is used, which is the use of low intermediate frequency electric shocks. It is believed to help slow down or sometimes even reverse the tumor's growth by interfering with the meiotic process involved with the cancer cells. The name of this clinical setting electric therapy is Optune therapy, and it has been found to increase the survival rate of glioblastoma patients by 31%.
So this is our volcano plot representing a single gene that was researched. To explain the plot a little more in depth, the y-axis is the p-value, and the higher the placement on the axis, the lower the p-value is. This means there's more significance in the gene expression. The y-axis is the difference in the gene expression. Positive values are genes that are expressed more in unhealthy patients rather than healthy individuals. The negative values, which are the left, are genes that are expressed less in unhealthy patients rather than healthy. And then the green is, you just ignore that part.
When it comes down to it, we found that there were much more significantly expressed genes in glioblastoma patients rather than healthy patients. As we got closer to zero, much of the expressed genes became non-significant, which leads us to believe these genes to be ones that actively showcase the potential for glioblastoma. Among the analysis of our gene signatures, we found that upwards of 150 different genes could be identified in association with this growth of glioblastoma. As a result, among these genes associated, figuring out much more targeted methods to tackle locating the genes that express the most evidence towards the potential of glioblastoma would be ideal towards adding a much more productive perspective on the underlying molecular mechanisms associated with its growth. If the possibility arose that you could locate the associated genes and quell or hamper their growth before they're able to express the glioblastoma, then it's potential that the survival rate would be much more significantly higher than that in which the cancer has already been expressed to. Thank you.
This is our reference page, but other than that, that's all we have.